Fetal alcohol spectrum disorders is an umbrella term used to describe a group of conditions that affect a person because their mother drank alcohol during pregnancy. This group probably accounts for the most common preventable cause of non-genetic learning disability. Such individuals may also be affected by a number of complex, lifelong, physical, mental, psychological, and emotional problems, all because of that exposure to alcohol as a fetus.
FASD is caused in two broad ways, either direct or indirect. Where there's direct damage, the alcohol is taken in and directly affects the cells as they're developing. The second way is that it modifies how genes, which make us all up, are expressed. And so normal development may or may not happen. That leads to malformations or abnormalities. There are a range of characteristics that you may see in somebody with FASD. The most common that most people focus on are the facial characteristics. That tends to be small eyes, thin upper lip, and a flat philtrum. They're rare. They only develop in a very short window during the early part of pregnancy and affect about 5 to 10% of the whole group. The bit you don't see is the brain. So the brain is invisible in terms of what it looks like, but it's developing throughout pregnancy. FASD can lead to problems with memory, problems with what we call your executive function, which is your planning, how you organize yourself, how you multitask, all those factors that are really important in life, they just can't do. And what happens is the more society demands from them, the less they're able to manage. The later it presents, the more likely it's going to be put down to bad behavior, bad parenting, both of which may be inappropriate. Actually, what you need to be looking for is why the brain is not working properly, and not just focus on the behavior, which is superficial.
There are many recognized effects on the lives of individuals with FASD, and these require timely support, preferably from an early age. If it's not diagnosed, they can develop secondary conditions which have lifelong implications and can cause significant stress on the individuals and their family or caregivers. Examples include disengagement from education, services, and relationships. These secondary conditions can place them at a higher risk of mental health issues, self-harm and suicide, substance abuse, and involvement with the criminal justice system. Alcohol exposure during pregnancy can cause irreversible damage to the structure and functions of organs in the body, particularly the brain. Therefore, the characteristics of FASD cannot be cured. The needs of each affected individual require specialist assessment and lifelong support, which sadly is not always readily available. However, timely diagnosis and support can, and indeed has been shown to, lead to more positive and fulfilled lives.
I've been working with FASD-related conditions for 15 years now. In that time, there has been slow but steady progress. But there's no training, there's no research funding, there's a lack of understanding still in the general population. Medical students, doctors, healthcare professionals, teachers, through to legal professionals, if we don't educate them, the situation just perpetuates. Unless we can develop the science, get the evidence, and then improve what we know, we're not going to be able to educate these groups, and the people with FASD are going to continue to be unsupported.
If you're pregnant or thinking of becoming pregnant, the safest approach is not to drink alcohol at all, in order to keep the risk to your baby to a minimum. Drinking alcohol during pregnancy can lead to long-term harms to your baby.